All I can say is that from my own experience, you don't want to be in a situation that you're diagnosed with cancer and you have regrets because you simply didn't take the time to go get screened. Once you get diagnosed with cancer, you're going to be doing screenings every year of your life going forward. I'm doing them every 6 months. So you may as well take the time to be proactive and do it.
Cancer affects everyone. If you look around you, your friends, your parents, your sisters, it's really important that you take care of your health or anyone you know as soon as you have any symptoms or warning signs.
And the guilt that I had as a mother for what I was putting my children through was insurmountable. My children went from thinking that they were going to lose one parent to now thinking that they could lose both, because it was always my husband that was the one with the chronic illness. And all of the pain that I was causing them was simply because I wasn't prioritizing myself and my own health while I was trying to do everything else. There was a period of 12 hours that I didn't know what stage my cancer was. And it was at that point that I just got on my knees and prayed to God. And I remember driving to the hospital to visit my husband in the hospital one day, and God spoke to me and said, "Aren't you glad that you didn't wait to need me to know me?"
When someone's undergoing treatment for cancer, I honestly would say it's tougher for their loved ones than themselves. And really taking into consideration your family, your friends, they would always want the best for you and the importance of getting screened earlier.
My husband's health journey was over a course of 10+ years that he was diagnosed with a heart failure. The irony that he had a physically weak heart, when in reality his heart was bigger than life and would give to anybody and anything. I think Warren would be proud that we are trying to share his story and help somebody else live.
Heart disease is the #1 cause of death of men and women in this world. African Americans are 30% more likely to die than their non-Black counterparts in this country. But this is something you have control over. I'm giving you the empowerment. You have it. You can take care of this if you just look for the answers to the questions. What's my blood pressure? Is it in a dangerous range? Do I need medication? Do I have diabetes? What should my weight be? Should I start walking? How much do I walk? What can I do? And if I'm smoking, I can't afford to smoke.
While my mom had colon cancer, my dad also had heart failure. So for multiple years, until my dad ultimately ended up passing away, there were times, like on my 15th birthday, when both of my parents were in the hospital at the same time and they couldn't be there for any of the celebrations.
If you don't have your health, you don't have anything. You need your health to spend time with the people you love, to spend time doing the things you need. Your health is the most important thing that you have.
You don't want to have the guilt of hurting your family that you love so much simply because you weren't taking the time up front to prioritize yourself.
So please, please, take care of yourself before something happens and the people who love and depend on you don't have you there anymore.
So if you're thinking of skipping out on anything relating to health, just don't do it, because you don't want your kids to not have either of their parents with them on their birthday.